Hello everyone and welcome to Vet Candy Pop, your go-to source for all things trending in the world of veterinary medicine.
We're your hosts, Dr. Elan Armstrong
and Dr. Shannon Gregoire.
And we'll be diving into the hot topics, breakthrough treatments, and cutting-edge research that's shaping the future of veterinary care.
We'll break it all down for you in quick, bite-sized episodes, whether it's new trends in pet health, industry insights, or even the latest challenges we're all facing as veterinarians. We've got you covered.
Get ready for an exciting ride as we tackle the tough questions and keep you up to date with everything you need to know, all in 15 minutes or less.
So grab your coffee, sit back, and let's dive into today's episode of Vet Candy Pop.
This program is brought to you by PRN Pharmacal, makers of Reconcile, fluoxetine hydrochloride. Learn more at reconcile.com.
So I think today we should talk about the fact that a recent study showed that 45% of millennials report that their job negatively impacts their mental health.
That's a high percentage.
It is. Yeah. And do you think that's accurate for the veterinary profession as well?
Absolutely. Hence, not one more vet. It's such a grueling topic that we have to circumvent, and just knowing that we have groups like that and we have these rates and we have these stories at least once a year of someone passing away, we kind of make the assumption that their job has something to do with it as far as like the stress that has impacted their life. But we always hear about veterinarians and the suicide rate. And so, people don't just wake up one day and make that decision. It's like a culmination of many things. And because we spend so many years of our lives and so many hours of our day in the hospital, we know that our job impacts what we do. So it's sad. And I think that we should just, talk more about it. So let's do it.
Absolutely. Yeah. We give so much of ourselves all the time. And I think a lot of people struggle with refilling their cup.
Yes.
Refilling that ability to give. And it's hard.
Yeah, it is. So how do you find that it, the mental health issue and the emotional well-being, do you find that it impacts your ability to communicate with clients or interact with clients? Do you find that your interactions with them impact your mental health?
I guess it's hard. I think I've tried to kind of obtain the mindset of I do the best that I can at the time that I am there with the tools that I have for that particular patient
and the information that you have,
the information that's available at that time, everything that's there, and then I do the best that I can, and that's it. And then I just try to let it go.
Were you like that when you first started practicing, or do you think that's something that you've had to learn over the course of time?
I think I had to learn it pretty quickly because there will be cases that don't go well or that you referred or not. Some that surprise you and go miraculously well. So it's kind of just knowing that life's going to happen and you can try to positively impact that situation as much as you can with the tools that you have. But that ultimately the result may be out of your hands.
Absolutely. Absolutely.
So trying to relieve yourself of that stress of that the whole world is on you, it's not. It truly isn't, and I think that was super helpful for me. What about you?
It took me some time, and it was one of those things where I wish they had taught us in vet school that we would have a lot of mental roadblocks. Now, as far as dealing with clients is concerned, that also took time to navigate. Anytime I'd have difficult discussions with clients, discussions that would end up not going well. When I would have difficult discussions with clients, I would always let it rest on my shoulders for the duration of my shift. And so that would impact my mental well-being because if you have shift after shift after shift, they're all grueling. This is ER. And you're just having these negative interactions weigh on your shoulder time and time again. By the end of the week, you're mentally done, right? Now imagine having to go home after a difficult shift and you have now the demands of home. even if you don't have kids, it's your pets that are looking for affection. Your spouse is looking for affection. And you're just like, I can't.
Yeah,
I can't do it. I can't give. So what you said earlier about you can't pour from an empty cup, that's important. And that's why, trying to find that balance of like self-care and things like that really play a huge role.
Yeah, absolutely. Because it's hard when you have a job that requires so much of you emotionally, and pet owners are always like drawing off of you to feel comfort or safety. So and then you give them, odds that might not be so great, and then their stress impacts your stress.
Absolutely. And then let's talk a little about like compassion fatigue, because once we get stressed over a period of time, I mean, we start to get eroded. You know what I mean? Like our souls get eroded
less
and
emotional,
less emotional. And there's definitely, in my opinion at least, a difference between exhibiting professional detachment sometimes just for the sake of, our own mental health versus just having that compassion fatigue where we are not aware how just hardened we are becoming. So sometimes our team members can pick up on it or clients can pick up on it. So what are your thoughts on compassion fatigue?
Yeah, I think it's sometimes when we, I forget the term for it, but you mirror your own experiences or your own life too closely to your clients and your patients all the time. So I think a little bit of professional detachment can be healthy to the point where you take a step back and you try to communicate with the situation as that neutral third party that you're supposed to be, that you're the doctor, you're not, the owner of this pet, and you're trying to make, your doctor decision is not based on emotions, it's based on what, your diagnostics are telling you and your exam and everything. So I try to keep a little bit of emotional distance, not for empathy or anything like that. Like I will, still show concern or sadness or happiness with whatever it's going on, but I try not to think about like my pet that's had a similar experience because then I'll get too attached to what's going on and what's happening when I shouldn't be, just for my own well-being.
But question for you. What if you have a pet owner that says, if this were your pet, what would you do? How do you handle those questions?
It depends. Well, with my own pets, I'd always do referral.
Yeah.
And I have pet insurance in my own dog, and I always I would rather do more diagnostics and rather it not be fruitful than not do something. And I know that's not every client's prerogative, but I'll tell them that and be like, I would go even if it's normal.
Right.
Like, it's just a peace of mind. I like having that peace of mind.
Right.
But if you're financially constrained and we can't, like, there are other steps that will come close, but maybe not the same thing. But I mean, that's what kind of pet owner I am. I'm always going to ship my dog off to do whatever she needs to do. And I had to do that one time, and everything came back normal. And we didn't get a diagnosis, and things turned out fine. But so I try to tell those experiences too, that you might spend some money and not get a diagnosis, and that's okay.
Right.
But it all depends on what they're okay with.
Right.
Because what I'm okay with might not be the same thing as what they're okay with.
Absolutely.
So, it's kind of hard depending on what that financial situation might look like.
Oftentimes whenever I get the question, what would you do? It's whenever I have a situation where the pet ideally should be transitioned versus trying to keep going in like life support. So oftentimes, whenever they ask me, what would you do? I find it hard to answer, but I end up thinking back, and I'm bringing this up because you mentioned sometimes you try not to think about your pet in a situation, but I do end up thinking about one of my pets. And so I'll sometimes use her story as a way to kind of gently push euthanasia. You know what I mean? But then I still try to say, as you said, but this is what I would do. This is not, this is not my pet right in front of me. This is your pet. So at the end of the day, it's your decision to make. But, compassion fatigue is something that I think that we ideally should be more aware of, as is feeling just the strains of burnout on our mental well-being, So
yeah, absolutely. I think that was really great.
So I once had a shift where I had 7 euthanasias was in a 12-hour shift. And then my colleagues ended up calling me Dr. Death. Now, at the time, we laughed about it, right? Because again, dark humor to survive. But by the end of that shift, I felt, again, eroded. And I was just asking myself, who do I talk to? I can't talk to my husband. He just doesn't get it. I'm certainly not going to talk to my kids.
Right.
Me talking to my other colleagues, they feel their own stress, right? And so I had to find someone else to talk to. So then I decided, why not a therapist? It's something that I feel like we should reach out to more, like as far as like seeking therapy. And that's exactly what I did. And after maybe 3 or 4 sessions, I actually felt a lot better. Things that I addressed, my compassion fatigue, my burnout, how do I process emotions and having to switch it on and off whenever I'm going from a euthanasia to something that's not as critical. Because we never really realize like how much that wears on us. And so, you know, we're already living in a world that's like full of depression. We experience depression outside of the workplace, and then you're working and there's more things to add to your bucket. You know, we need an outlet. So in my opinion, whether it's therapy, whether it's even medication sometimes, it doesn't have to be forever. It can just be for a couple of months. I feel like it's so critical. What about you?
Yeah. For me, I think I found a lot of books really helpful, or even podcasts that talk about these different things, because then you get to hear about what other people are talking about and kind of what their strategies have been with coping with emotions. And I think for me, one of the people that I talk to is my parents a lot, because they don't know a lot about like this industry.
So they offer like a fresher perspective?
Yeah, or they recenter me.
Ah, I like that.
Yeah,
I like that.
They're good at kind of talking about what actually matters. Or like, I had a day when I had a lot of euthanasias too, and it was heavy, and they're just like, you're saving pets.
I like
Never
that perspective.
forget that.
Yeah.
All you're doing is saving them. And I think that's really helpful.
I like that a lot. That's so important.
Yeah.
Wow.
Hello, I'm Dr. Wailani Sung, a veterinary behaviorist and owner of Bay Area Vet Behavior. And today, we're talking about separation anxiety. Management of separation anxiety typically necessitates a multifaceted approach encompassing behavior modification techniques and, in certain cases, pharmacological intervention. Medications such as FDA-approved Reconcile chewable tablets containing fluoxetine hydrochloride can be used adjunctively with behavior training to help with anxiety. Reconcile should be used in patients with separation anxiety that exhibit a high level of distress in the owner's absence. So, how does it work? Reconcile is a once-a-day flavored chewable tablet that contains fluoxetine hydrochloride, which is a selective serotonin reuptake inhibitor, an SSRI, and it is indicated for the treatment of canine separation anxiety in conjunction with a behavior modification plan. Serotonin reuptake inhibitors work by blocking the reabsorption of serotonin, a neurotransmitter responsible for mood regulation, into nerve cells in the brain. By preventing serotonin from being taken back up too quickly, SSRIs help to increase the levels of serotonin available in the brain's synapses, which enhances communication between nerve cells and helps regulate mood and anxiety more effectively. Now, let's talk about the science. According to a study, at the end of an 8-week study, 73% of dogs treated with Reconcile chewable tablets show significant improvement as compared to behavior modification alone at 51%. During the course of therapy, 42% of dogs showed improvement within the first week, which was significantly greater than with behavior modification alone at 18%. The patient's response to therapy should be monitored. If no improvement is noted within 8 weeks, case management should be reevaluated. You can review the prescribing information for Reconcile by scanning this QR code.
And that's it for today's episode of Vet Candy Pop.
Thank you all so much for watching.
If you have a hot topic you want to share, connect with us at My Vet Candy.
Bye.
Bye.